Yours.
Thank you, Manoj. Respected General Venkatesh, my teacher and my PG guide, respected seniors, friends, colleagues, and the organizers who have called me for this particular event. I'm planning to give a talk today on transforming AI, as was being mentioned by Himanshu. There? Yeah. So because we have been talking about AI and all its manifestations, and probably what we are seeing is something like what we used to see the seminar of recent advances in ENT. I was just reminded of that seminar. So something of this sort which was being brought out by many people. Fair enough. What I'll try to do is talk about translating this particular thing which we're doing in clinical practice. How does it relate and what should we be doing? There's a specific emphasis I've been told to talk about the pros and the cons of this particular technology as we adapt it. First things first, we are not here to judge or say whether we should adopt AI or not. For the simple fact that for whether we like it or not, whether we think it's correct or not, whatever the pitfalls, we cannot stop it. So it's in our lives, and as was being mentioned a bit time earlier with Siri and all these things, it's already there in your pockets. So AI is there big time in your lives, and if we say that it's not going to be there in my medical profession or not in healthcare, or it doesn't relate, that's not the point which we're going to talk today. The economy, the health economic statistics just tell us the amount of money which is being pumped into AI in healthcare. And obviously there must be some reason behind this, and there must be some force, and this is only bound to increase by leaps and bounds. When I see all this, I just come across this, and this is, I agree this is a cartoon, but I think this is more than just a cartoon. So if you can just read this, AI definitely is also being, what I would say, hyped up or marketed or used as a buzzword for a lot of things which are not really AI. Or even otherwise, even if it does not work, if it's AI, it's the in thing. And if it's not AI, it's not the in thing. So this is something which also I would like to start off with. So when we say AI, two things come to our mind. And that's a very genuine reaction. It's a very genuine reaction. A new technology, which is, they call it a general purpose technology, comes into our lives. We have fear and we have hope. So we always expect something out of it, and we fear something out of it. So obviously, we all want some things beneficially out of it. And we think, as was being just being told, that it will let us take better decisions. We will become better doctors. And that's famous saying that people with AI will replace people with no doubt AI and all that. So there will be better patient outcomes, we hope. We hope the reduction of errors will take place. We know that we need more quality time with patients, and we think that we're going to get more time because we are focused on less tasks which are more robotic in nature. It will be a valuable tool to us to assist us, and it will mean better productivity for even the investments which are being done in healthcare. So this is what we hope AI will do for us. We also fear at the same time that to a certain extent, we know AI is a competitor. Every job knows it. That this is something which if I don't master, it will master me. So this particular thing, and I want to know my enemy well. This is something which also, whether we like it or not, is there in the hearts of some of us, most of us. By 2015, they say 15% to 16% of all American jobs which exist today are going to be replaced by AI. And then Dr. Vikas and Dr. Vikas have just added robotics and more robotics. And this particular saying, AI won't replace humans, but humans with AI will replace. Definitely this sentence itself conveys or betrays a fear. We also have immense fear of missing out. I think if it's not AI, something is wrong. So it's not a joke, but then it's a fact that there are 4,500 engineering colleges in the country today which offer a graduate course on AI. I guess it will be 200 per college. So So you can imagine per year is what I'm talking. This year, we have 3 CMEs in the AFMS with the theme of AI. I just searched yesterday, there's a very famous website on conference alerts about how many conferences are there on AI. So today there are 11 international conferences which are taking place just on AI. And I thought that Python was a snake. So I think we need to understand that we also are living under this fear of missing out, that if we've not really done AI, like tum to reh jaoge types of thing, sort of thing. So let's weigh some benefits. Let's look at how it can benefit us in tangible, practical ways. And I have divided these use cases into 4 large categories: the clinical care, the research part, the education part, and the administration and the management of healthcare itself. When we're talking of healthcare, and I think the biggest use case, whatever we might say as ENT surgeons finding an odd case for a rare situation, is going to be our clinical decision support systems. And these already exist. Your patients are already carrying this. Ideally, they should be meant for the doctors only, but they're already carrying this when they're coming to you because they have been given an artificially generated diagnosis before they come to you. Essentially, they all have virtual assistants. How many of you would have used ChatGTP to ask about a disease? And show of hands, yeah. So I'm sure there'll be many of them who would have done this. So add a clinical decision support robot or a bot, not the robot, which is like a virtual assistant on steroids with lots of loads of information on medicine, is something which is going to get integrated more and more effectively into our hospital information systems, to that extent that when you're prescribing something, it will even go and nag you. It will be like a backseat driver. So it reminds you about the protocols if you break them. It suggests you the diagnosis. It checks the right dosages. It will say, do you know this gentleman, Mr. Ram, also has hypertension and he also has a compromised kidney, and therefore what you are giving him for your skin, is it right? So things of this sort, which you will not otherwise think. So this is something which AI, clinical decision support systems, are under development, and this will be very easily implemented in your practice. They reduce medical errors, definitely they will. The next place where they're going to help you a lot, and this is where, is for diagnostic help. Now this comes with a caveat as well. The digital radiologist and the pathologist are here. So they are the ones which people now say that make diagnosis even better than them. They make it faster and they make it earlier, and they do not ask for clinical notes also, by the way. So this has got a huge application when it comes to cancers, and definitely it's playing a huge role. We are silent on one topic. If he's better than, or he or she is not as good as a machine, what happens in case there is a software-induced harm? What if the software does a harm? It does a diagnosis which is not there. It got an error. So this is something which we really can't answer so easily. And therefore, we have put the man in the loop, was what was told in the morning. Very well knowing probably that the diagnostic accuracy of that man may be less. Documentation is something which is very easily, translation of languages we are already doing. And this is something which we can translate, use AI to translate, and by making better clinical notes, and also reduce the legibility itself. So summarize free text and notes and extract relevant facts. Summarizing, if you have used ChatGTP or one of these generative AIs, you'll realize you just give them a big PDF document and says, please summarize this for me. It'll give you a very neat, good summary. So this is something which you can always be using. Patient communication. Now this is interesting, and this is something which we felt that we used it as an excuse maybe, but we felt that we couldn't communicate with our patients good enough because we didn't have time. I don't buy that argument always, but definitely this was used. So, and therefore we need more dedicated assistants. So what has happened is NVIDIA bought a company called Hippocratic AI, and they have created virtual assistants, virtual nurses or virtual counselors, you can call them. I played this video once earlier, and this is something, it's a person who will counsel. This patient has just undergone a surgery. I'll just play this short video. Now these are available for rent by the hour.
Hi, Sarah. I'm Rachel. your AI care manager. How are you doing after your appendectomy?
I'm good. I'm glad to be home with my dog, Dennis.
It's great to hear that you're back home with Dennis. I noticed that Dr. Chang has prescribed you some antibiotics, specifically ciprofloxacin and metronidazole, due to your ruptured appendix. Were you able to get these medications?
I was. I did forget to mention to the doctor that I am allergic to penicillin. Is it still okay to take the medication?
Great question. The antibiotics you've been prescribed, ciprofloxacin and metronidazole, don't contain penicillin. So it's perfectly safe for you to take them. Can you begin taking them today?
Yeah, I certainly can. Do you have any tips for faster recovery?
Given that you have diabetes, keeping your blood sugar levels in check will be beneficial for your wound healing. Your hemoglobin A1C was at a healthy level of 5.5, but your glucometer readings from yesterday were a bit on the high side. So keep taking your metformin and try to steer clear of foods high in carbs. How does that sound to you?
I think I'll be able to avoid the carbs for the week. I need to go right now, but it was great talking to you.
I'm glad we had this talk. I'll pass along your progress to Dr. Chang.
Goodbye.
Goodbye.
And if you felt this was something which is just one-off, this is how it's advertised. You get a cost. You have a rating which is rated by humans as of now, which rates that this is how good this particular nurse is in counseling, and this is what the knowledge background it has. This is now operational by and not by a small company, this is by NVIDIA, which bought this company. And yeah, there's a lot of variety. You can choose the person, you can choose the disease, you can choose the cause, you can choose a pre-operative counseling for getting a tonsillectomy. Or so this counseling is left. And you see, for a healthcare person who's invested money and is doing business, he may feel that it's better to employ such a person than deploy a person who probably will even get angry once in a while and get late. So you see, there are a lot of economics also involved in these things. What is very important was brought out in the morning, and something which is going to help us big time is the medical Internet of Things. And using AI to capture all this data and make sense of it is actually not easy for a human. So the gathering so much data, trying to find patterns. Now, whether these patterns are sensible or not is a separate issue. And remember, like, this intelligent monitoring will go one more event further, and I think it's the next slide. Yeah, this is something which was being mentioned, I think, by, again, General Venkatesh in the morning. It's a very futuristic thing, that geriatrics is something which is going to hit us bad, maybe in the next 20 years or so. And that is the time, in the next 10 to 20 years, we can't have so many hospitals. You can't afford that healthcare. And healthcare will move to the home. And for that, these AI-enabled IoT devices have got a huge potential. And this is something which we need to start investing in and looking at as monitoring devices to know, yes, this person had a fall. This particular person had likely to have a stroke. So these AI-enabled warning systems, they're all predictive in nature, and trying to make, they will reduce the time needed for readmission, the numbers of readmission, and definitely lead to better quality of outcomes. This is something which is going to be big. We come to the training aspect of it. Definitely we saw, those of you who attended the inauguration today or who will be seeing it tomorrow, the AI-enabled medical training, the technology having its role. So complex simulation training can be done. How AI comes in, the AI becomes a tool to sort of do adaptively adapt to your performance. It's something like what happens in some exams. Depending on the complexity of the case increases as you are operating. So you can have a personalized tutoring. The AI can grade it. You can even train for AI-enabled practice, and medicine needs AI as much as AI needs medicine, even for the training part. So that's very important, that the AI-enabled training is something which is going to be important. There are a lot of opportunities for research when it comes to AI. More importantly, we have to identify use cases. Again, this hype thing is taking to you. We want to diagnose everything, including earwax, using AI. So first of all, one has to identify a research question, as in any other research question. find the use case, whether it is useful to really use an AI tool at all in that particular situation, and then try to develop a tool. Instead of saying, I have a tool, now I'll fix every nail which I see on the wall because I have a hammer in my hand. So that is another